Hello, and thank you for visiting the Medina Clinic. My name is Dr. Murad, the volunteer medical director for the Medina Clinic, which is a charitable primary care clinic located in the southern greater Kansas City metropolitan area in Grandview, Missouri. The Medina Clinic is a site where licensed assistant physicians in the state of Missouri can volunteer and acquire valuable clinical experience that will help them in their application to residency programs through the match. One of the goals of the Medina Clinic is to provide professional development opportunities for assistant physicians so that they can put in time to provide community service and then subsequently go out, progress in their careers, and then serve and take care of future patients. The Medina Clinic has been a site for assistant physicians since 2016, and since that time, we have had 36 assistant physicians successfully match into residency programs for a match rate of 55% of all assistant physicians that have volunteered at the Medina Clinic. What I would like to do is to share three things. I'd like to share what an assistant physician does while volunteering at the Medina Clinic. Secondly, I'd like to talk about what it is that an assistant physician puts in terms of what energies and tasks that they invest in, and what work essentially they put in. And lastly, what an assistant physician can expect to get out of their volunteer experience at the Medina Clinic. As far as what an assistant physician does, an assistant physician volunteers to see patients under the supervision of an experienced clinician here at the Medina Clinic. The assistant physician would enter a collaboration agreement with a licensed and board certified family physician and would volunteer here at the Medina Clinic to see patients, again, under the direct supervision of a clinician on site. The assistant physician would see patients, get a history, perform a physical exam. Of course, the assistant physician, as a prerequisite for volunteering at the Medina Clinic, needs to be licensed in the state of Missouri. The assistant physician would also order labs, would order imaging, would make referrals, would assist in office procedures at the Medina Clinic. They would call patients back with any lab results, with any other instructions for patients. And the assistant physician would see patients for follow-up appointments and to discuss with the patient and put into place longitudinal plans of care, again, under the supervision of an experienced, licensed clinician who is on site. In this fashion, an assistant physician sees patients in much the same model as a residency program. And in this way, an assistant physician can gain valuable experience that will help them not only match, but also to succeed while in residency. As far as the commitments or what it is that an assistant physician puts in, it's a few things. Number one, an assistant physician is expected to volunteer at least once a month, at least one full day a month, whether you are local or whether you live elsewhere in the United States. Secondly, an assistant physician is expected to check their electronic inbox every day. An assistant physician is responsible for completing the office notes for the patients that they see and for signing it in a timely fashion. And so they will have access to our electronic health records. Also, this is in preparation for their future careers as residents and subsequently as practicing physicians. And so assistant physicians are expected to check their electronic health record inbox every day. This is part of good performance, and this is part of good professionalism, and this is the type of professionalism and performance that is expected in a future resident. So an expectation is that an assistant physician checks their electronic health record inbox every day. They need to call patients back to discuss lab results, or a patient may call with some questions that they need answers to. And so this is part of providing quality care, and that's something that we take seriously. So that is an expectation. Also, we have high expectations for professionalism in general of assistant physicians. And so to be punctual, to be affable and professional in all interactions is key, as well as to abide by any policies and procedures that we have here at the Medina Clinic. The last major expectation for assistant physicians that I would share is that recently the Medina Clinic has implemented a rotation that lasts for 4 weeks, whereby the assistant physician meets with myself, typically over Zoom, where we undergo a tutorial for how to document clinic notes in the electronic health record after seeing a patient, as well as how to present a patient. This tutorial or abbreviated rotation is mandatory for assistant physicians to complete. This will help them succeed at the Medina Clinic and also give them a good foundation as they acquire valuable clinical experience. As far as what an assistant physician can expect to get out of their volunteer experience or what they can expect to gain, I would mention a few things. One is real life, hands-on clinical experience under supervision, which will be very valuable as an assistant physician applies through the match. To be honest, I'm not so sure volunteering at the assistant physician can help you get an interview. However, I am confident that the Medina Clinic would be amazing and very valuable experience to share during an interview. And this will demonstrate that you have valuable clinical experience that will help you to function effectively while in residency. So this hands-on clinical experience is very relevant and very valuable, especially if it has been at least a few years since an assistant physician has graduated medical school. Secondly, an assistant physician can expect if they are deserving and highly professional and punctual and do all the things that they need to do and are a professional, valuable member of the team, they may earn a letter of recommendation that can be a part of their application to residency through the match. Also, because we care about the professional development of our volunteers, assistant physicians can have a complimentary one-on-one interview prep session in order to help them prepare optimally for upcoming interviews. In addition, also, because we understand how difficult the match can be and how important it is to put your best foot forward, we, on a complimentary basis, review your personal statement and give you feedback so that you have so that you can produce a personal statement that is reflective of your story and your experience and why you would be a great fit for a particular specialty or a particular program. Another benefit that you get from the Medina Clinic is you join a cohort of other assistant physicians who are in the same boat you are. You are all applying for residency. I'll be honest, I may not be the best source on strategy for applying to residency. I can definitely help you with the interview process, can definitely give you feedback on personal statements, but it will be other assistant physicians who are going through the same thing you are that you will be a part of a cohort with, that you can, from whom you can benefit from their experiences, from their insights. You can benefit from your peers, and as a group of peers, you can teach each other. And so to be a part of that cohort and to expand your professional network is something that is very valuable. Also, you will have access to the contact information of all the previous assistant physicians at the Medina Clinic who have matched into residency programs. We are fortunate to have had multiple residency programs in the United States, accept multiple assistant physicians from the Medina Clinic. And so anytime an assistant physician matches to a residency program, they commit to being available for future assistant physicians so that they can pay it forward and to help future assistant physicians in terms of having better opportunities at applying to and matching to residency programs. So to be a part of this professional network of other assistant physicians who have succeeded into matching to residency, as well as other current assistant physicians who are in the same shoes you are, is something that you will benefit from as well. And so all in all, we hope that you will see, if you are a prospective assistant physician considering volunteering at the Medina Clinic, that you will consider doing so and to benefit from the wonderful experience here in a way that allows you to put in a community service to serve others, and in so doing, acquire experience and acquire an expanded professional network that will help you in your professional journey. Thank you.